All right, so we're doing our project on reducing the use of physical restraints while maintaining patient safety. Our group members are Mary Gillum, Brittany White, Michelle Fennick, Joanne Jones, Michelle Snyder, Mimi Santiesteban, and Brian Wilson. So first we have a comic that maybe you'll enjoy. The bottom it says, "Hey, I think he just moved, add another one." And that's a patient who's been thoroughly restrained. So that just kind of like sets the tone for what we're trying to teach today.
Restraints is defined as a physical restraint is a human, mechanical, and/or physical device that is used with or without the client's permission to restrict his or her freedom of the movement or normal access to a person's body and is not a usual part of treatment plans indicated by the person's condition or symptoms. And that is defined by Potter and Perry, which is in our fundamentals book. It is also defined as devices, material, and equipment which are attached to or are adjacent to the patient's body to prevent free bodily movement to a position of choice by standing, walking, lying, turning, or sitting, and cannot be controlled easily or removed by the patient. So why use restraints?
Changes in patient's mental status, prevent falls, to protect others' safety, to facilitate treatment, non-compliance, prevent disruption of tubes and dressings, to manage violent behavior, and to prevent the patient from harming themselves.
So there are a lot of challenges associated with restraints, and so there are physical challenges. So death can occur by strangulation. There's also a risk of hypoxic encephalopathy, also skin abrasions, pressure sores, and flexion contractures. And there's also psychosocial challenges such as decreased socialization and also the loss of autonomy that occurs if they're placed in restraints. They no longer have the choice to get up when they want to. And also a lot of times there is stress on the nurse and they have this guilt for having to put the patient in restraints. And so realizing that yes, there are benefits to restraints, but at the same time there are also a lot of downfalls associated with them. So these are the challenges that occur. So this was defined as a national indicator. So CUSIN defines safety as minimizes the risk of harm to patients and providers through both system effectiveness and individual performance. And reduction in restraints is also indicated as a national database of nursing quality indicators. So essentially, reduction and proper use of restraints will minimize the risk of harm to both patients and nurses and increase the quality of patient care and safety. So the reason why this is a key issue is because you're protecting both the patient and the provider by properly using the restraints. And reducing it has been shown to keep a safer environment for both the patient and nurses.
So the learning objectives are to define restraints, to identify common challenges of restraints and how national indicators influence healthcare facilities in making necessary changes, to compare various healthcare facilities' mission statements to the theory of human becoming to see how these principles influence the driving force behind addressing issues of restraints, to identify best practice according to literature concerning the use of restraints, and to learn how to develop a plan that will appropriately educate staff nurses on how to safely use restraints. The goals are, we want our hospitals to actively reduce the use of restraints. When restraints are necessary, it is our goal to use them in a manner that protects our patients' health and safety while protecting their dignity and rights. Restraints should be used as a last resort.
Mm-hmm. So, facilities mission statements compared to human becoming theory. So we looked up each of our hospitals that we've been assigned to, what their mission statements are, and then we compared them to Human Becoming. So hospital number 1, their mission statement is, our mission is to deliver compassionate healing, advocacy, and build healthier communities. The second hospital, their statement was, our mission is to assist patients and families to achieve functional independence and self-sufficiency. The third hospital, their mission statement is to provide superior quality health care to residents with a special focus on individuals and populations in need. And then the quote we have from the Human Becoming Theory is, the Human Becoming Theory offers an alternate way of living nursing that focuses on the nurse being with the person, the goal being quality of life from a person's, family, community's own perspective. And we feel like that is the heartbeat of Human Becoming, focusing on the individual, and we see that all these hospitals' mission statements are very in line with that theory.
Okay, best practice for physical restraints, screening and assessment, cognitive assessment, medical history, residents' usual routines, physical pain, fall risk, and skin. Interventions include ensure the safety of resident and others, repeat assessment indicated above, implement environmental communication strategies and alternatives to restraints. Environmental and communication interventions include promote self-care and self-determination within ability limits, individualize daily routine as close to home, calm environment, minimize noise, calm voice tone, minimize invasion of residents' personal space, communicate with clear, simple instructions, identify and treat medical causes, low shadow-free lighting, and flexible routine.
There are some alternatives to restraint use. One would be personal strengthening and rehabilitation program, the use of personal assistance devices such as hearing aids, visual aids, and mobility device, use of positioning devices such as body and seat cushions and padded furniture, and efforts to design a safer physical environment, including the removal of obstacles that impede movement, placement of objects and furniture in familiar places, and lower beds and adequate lighting. Regular attention to toileting and other physical and personal needs, including thirst, hunger, the need for socialization, and the need for activities adapted to current abilities and past interests. Design of the physical environment to allow for close observation by staff, and efforts to increase staff awareness of residents' individual needs, possibility including assignment of staff to specific residents in an effort to improve function and decrease difficult behaviors that might otherwise require the use of restraints. Design of resident living environments that are relaxing and comfortable, minimize the noise, offer soothing music and appropriate lighting, and include massage, art, or movement activities. Use of bed and chair alarms to alert staff when a resident needs assistance, and the use of door alarms for residents who may wander away.
Key leaders needed to implement the plan include unit managers and unit educators to develop the plan and provide education and in-services to the staff. The charge nurses and staff nurses would then implement the plan onto the unit. The plan is to provide a mandatory education training course that includes education about the reasons restraints are used, the adverse effects, and alternatives to their use. The plan will be evaluated by providing a skills and competency test, which will be given after the in-service and education. Nurses will need to demonstrate safe and correct restraint use, verbally articulate why restraints are not always appropriate. Nurses who do not pass the skill competency test will have to do remediation and then retest with the nurse educator. Challenges to implementing this plan will simply be getting the staff to actually follow the plan. How we'll face these challenges. We'll face these challenges by providing remediation and then taking disciplinary action.
So our leadership perspective is delegation. The charge nurse will delegate staff nurses to implement the protocols and plans developed for restraints. Supervision. Each staff nurse will be responsible for reporting instances where a fellow healthcare worker fails to follow the restraint policy and management. The nurse manager will evaluate statistics concerning restraints and keep his or her employees accountable to the rules pertaining to restraints. And here are some additional questions. How can we better educate patients, family members, and patient advocates on proper use of physical restraints prior to implementation to prevent serious injury or death? What are the statistics of male staff using restraints versus female staff? What would be an effective amount of time for in-services to educate healthcare staff about use of restraints? What are the most effective ways to measure their competency and evaluate if teaching was successful? And how can organizations better strive to provide a restraint-free environment?